Learning objectives for today are: at the end of the session, students should be able to define and differentiate different terms like trauma, injury, hurt, wound, assault, and battery. Students shall also be able to define and explain the terms like qisas, diyat, wali, had, arsh, daman, and tazir. Out of these, qisas, diyat, arsh, daman, and tazir are the punishments. Besides, the student shall also be able to classify and explain and also discuss types of the hurts. Students shall also be able to define and explain different types of the qatl. First term is trauma. This is derived from the Greek word traumatos, which means bodily injury or wound or painful emotional experience. Then is the term injury, which is a legal term. An injury is defined as any harm whatsoever illegally caused to any person in the body, mind, reputation, or property. So a legal term which defines any harm which is made in a body, mind, and reputation and property to the property of the person is called as an injury. Now coming to the term hurt, this is taken from the Arabic language, which defines as whosoever causes bodily pain, disease, infirmity to any person or impairs, disables, or dismembers any organ of the body or part thereof any person without causing the death is said to have caused hurt to him. So from qisas and diyat, hurt is a term with this definition, means the case in which the person is not dead but he has suffered bodily pain, disease or infirmity, or impairment, disability or dismemberment of any organ or its part is said to have suffered from a hurt. Now in this we can see that there are two terms, disease and the infirmity. So what is difference between the disease and the infirmity? Disease is the objective diagnosis of any condition. Say for example, when we diagnose a malaria or we diagnose any other disease positively, while the objectively, while the infirmity means a subjective feeling of illness, subjective feeling of discomfort, subjective feeling of the sickness. So all these conditions, they are encompassed under one term, hurt: bodily pain, disease, infirmity, impairment, disability, dismemberment of any organ or any part of the organ without causing the death is termed as the hurt. Then is the term wound. This is a medical term. Wound is defined as the forcible solution of the anatomical integrity or continuity of any of the soft tissue of the body, including skin and the mucous membrane or cornea, caused by application of the force. So the wound is a medical term which refers to the break in the continuity, anatomical continuity of the skin, mucous membrane or cornea. Then is the term assault. This is a legal term. According to the section 351 PPC, the offense of the assault consists of making any gesture or any preparation, intending or knowing it that such gesture or a preparation will cause any person present to apprehend that the person making that gesture or preparation is about to use criminal force to the other. An explanation follows. For example, if the person A shakes his fist at Mr. B and causing the Mr. B to believe that Mr. A is about to hit him, then Mr. A will be guilty of causing assault. So, meaning simply making any gesture, making any preparation, or making any threat to the other person that he or she is about to use the force is known as the assault, but it is simply the gesture, the preparation, the threat, but not the actual use of the force. Assault, a legal term. Then comes the battery. Simply, the battery is the actual application of the force or the threat or the preparation which was an assault. When that thing, that preparation, that force is actually applied, it is known as the battery. So, assault is simple threat or preparation or a gesture, while the battery is actual application of the unlawful force. So after defining these terms, let us have a quick look or revision of the wounds or the hurts which we have already studied in our previous sessions. According classification of the wounds according to the causative weapons. Wounds can be classified according to the force. For example, blunt force, sharp force, or fast force injuries. So the forces or the causative weapons may be divided into three: blunt, sharp, and the fast force. Example of the blunt force injuries you have already studied are the abrasions, bruise, hematoma, lacerations, and the fractures. While the example of the sharp force weapon are of two types. Sharp weapons can be sharp edged weapons, and these can be sharp and pointed weapons. Sharp edged weapons like daggers and the knives and the scissors, they can cause incisions, cuts, and the slashes, while the sharp pointed like the tip of the scissors, they can cause the stab wounds. And if the stab wounds are only causing the entry wound, then these are known as the penetrating stab wounds. But when the stab wounds cause entry wounds as well as exit wounds, means the sharp pointed weapon passes through and through the part of the body, these are known as the perforating stab wounds. And the third is the fast force, which include the firearm injuries and the bomb blast injuries. Then thermal injuries like dry heat, injuries caused by the dry heat, and injuries caused by the fluids. Scalds are actually the injuries caused by the boiling fluids, while the dry heat produces the burns. Then are the electrical injuries, chemical injuries, and the radiation injuries. Then the injuries are also classified according to the motives and intentions. We are studying this chapter that we need to certify the injuries, the medico-legal certificates we have to issue, and in these medico-legal certificates, we, beyond other things, we also have to certify that what is the nature of the injury, or what is the opinion of the doctor about the injury, that what has caused this injury, number one, and what is the classification of this injury according to Qisas and Diyat Act. And thirdly, sometimes we may be asked to give the manner of the injury, that how the injury was caused. If we simply recall the manner of the death, the term manner of the death, in which we discuss that the manner can be suicidal, can be homicidal, and can be accidental. But in case of the, when we give such certification or give the opinion about the manner of the injuries, these manner of the injuries are further expanded. For example, if you look on this slide, injuries can be therapeutic, means the intention of causing the injuries were therapy, to produce the therapy or to produce the to give the treatment to the patients. Examples were the surgical incisions and the amputations. Then injuries can be motivated, or motives behind the injuries can be simply the sports injuries. The person were playing the sports and they get any injury due to that sports, especially the sports which involve the fighting, wrestling, uh, say karate, judo, and the boxing. In such injuries, such sports injuries are prone to happen. Then these injuries, manner of that injury will be declared as the sports injury. Besides, injuries can be suicidal, means intention to harm oneself. Injuries can be homicidal, means with the intention to cause harm to some other person. It can be accidental, simply there was no intention to cause any harm. Then number six, the injuries can also be the defense wounds. The wounds can also be classified as defense to ward off the attack. Say, for example, if some person is attacked, then that victim may ward off the attack by or try to prevent himself from the injuries by extending his forearm, by extending his arm, or in case the person was lying, then by extending his lower limbs or the feet, then person may suffer injuries on those parts of the body. And such injuries which were suffered by the victim while he was trying to ward off the attack are known as the defense wounds. So one of the motives or intention can be simply to defend oneself, and such injury will be classified as the defense injury. Number seven, the injuries can also be classified as fabricated injuries, means false injuries, which were simply caused to falsely implicate someone to get the punishment. And these fake injuries or fabricated injuries can be divided again into two: the self-inflicted and the self-suffered. Self-inflicted means inflicted by a person himself over an accessible part of the body to put the false charge on someone, and self-suffered, inflicted by a friendly hand over a non-accessible part of the body, means asking some friend to cause the injury on the non-accessible part. Say, for example, on a back of the body, injuries may be produced by requesting some friend and known as the self-suffered injuries. Now, fabricated and especially the self-inflicted injuries can be diagnosed by doing a careful examination of the injury. For example, such self-inflicted injuries are usually superficial. Number two, such injuries are caused on the opposite side of the body. For example, if the person is right-handed, his accessible part will be the left side of the body. And if the person is left-handed, then right side of the body will be accessible part to that person. So injuries by a right-handed person on the left side of the body and left-handed person on the right side of the body. I should have some doubt that the injury can be a fabricated injury. So number one, superficial. Number two, on accessible part of the body. And number three, always such self-inflicted injuries are on non-vital body parts. Person may not injure oneself on a vital body part. So that is also one of the indication that such injury can be a fabricated injury. And then it is also noted that in many cases, or in most of the cases, the person causing self-inflicted injuries interestingly tries to save his clothes. So the clothes do not have the corresponding injuries. This also should raise the doubt. So number one, superficial. Number two, on non-vital parts. Number three, on the accessible parts of the body. And number four, cloths do not have the corresponding injuries. All these points towards the possibility of the self-inflicted injuries. So if we find while in our examination that injuries could be fabricated, then we are supposed to mention it on our medico-legal report. Coming to the term qisas, so these are the types of the punishments which are actually the title of our today's lecture. Qisas, most of the term, all of the terms in qisas and diyat are taken from the Arabic language. So we need to understand it more precisely, starting with the qisas. Term qisas means inflicting same type of hurt on same part of the body of the assailant as he has caused on the body of the victim. As I already said, qisas is one of the punishment. So actually it is to punish the assailant, meaning the inflicting the same type of the hurt on same part of the body of the assailant as he has caused on the body of the victim. So term qisas. Then is the other term diyat. This means monetary compensation for death paid by the killer to the wali. If anybody causes the death of the other person, then that person is liable. If the court decides, then that person is liable to pay the amount to the family, legal heirs, or wali of the victim, and this amount is fixed, which equals to the value of the 30,630 grams of silver. Current rate of the 30,630 grams of the silver, its equal amount is to be paid as a diyat, and the government of Pakistan every year on July 1st gives the value of the diyat for the forthcoming year, and which is no less than 30,630 grams of silver. So qisas can also be claimed for injuries. Qisas can also be claimed for the death of the person. Similarly, for the death of the person, court may decide that the monetary compensation may be paid, or the wali may allow for the transformation of the qisas to the diyat. So depends upon the court orders, what court decides. Monetary compensation for the death of the person is equal to the value of 30,630 grams of silver. Term wali, as we discussed, means person who is entitled to claim diyat or the legal heir of the victim. Had, a punishment ordained by the Quran. So all these what we have been discussing, like qisas, diyat, and the coming punishments, all they come under the topic of the had, which means a punishment ordained by the Quran. Another type of punishment is arsh, which means a compensation is specified in qisas and diyat to be paid to the victim or his heirs under this chapter. So this is the compensation, monetary compensation for not the death but for the injuries. So arsh, for example, there is a loss of the functions of the organs, then arsh for single organs which occur in the body singularly, for example nose, for example tongue. So if nose is damaged permanently, there is a permanent loss of the nose or permanent loss of the tongue, then the arsh equals to the whole amount of the diyat. Similarly, if there is a loss of the organs or organ which occur in pairs in the body, for example hands, feet, eyes, breast, then arsh amounts to the half of the diyat. Similarly, for those organs which occur in quadriplet, for example, eyelids, then arsh loss of one eyelid, arsh amounts to 1/4 of the diyat. Similarly, arsh for the fingers and the toes amounts to 1/10 of the diyat. If a single toe or a one finger is lost, then its amount as an arsh or compensation amounts to 1/10 of the finger, 1/10 of the total diyat. And if any joint of the fingers or the toes is lost, then it amounts to 1/30th of the total diyat, because every finger has 3 joints, so it comes to 1/30th. Then for the teeth, the loss of 20 teeth amounts to the full diyat. So this was the some guidelines about the arsh, that is the monetary compensation which for the injuries mentioned in the Qisas and Diyat Act. Then is the term daman, which means compensation determined by the court to be paid by the offender to the victim of causing hurt not liable to the arsh. So any hurt which is caused and it's not mentioned, its punishment is not mentioned under the arsh, then court is authorized to decide for the amount of the daman. But for that, the court has to keep into consideration the following things: that the expenses incurred on the treatment of the victim, loss or disability caused in function or power of the organ, and the compensation for the anguish suffered by the victim. This is the way how the court decides for the daman, which is not mentioned under the heading of the arsh. So these diyat as well as daman should also be kept in mind for the doctors who are allegedly involved in the medical negligence. So doctors may also face different punishments according to the Qisas and Diyat Act. Then is the another punishment known as tazir. So any punishment other than Qisas, Diyat, Arsh and Daman, for example, jail imprisonment comes under the heading of the tazir. So if we simply recall total punishments or all the punishments according to the Qisas and Diyat, then these are the Qisas, number 1, number 2 Diyat, number 3 Arsh, number 4 Daman, and number 5 Tazir. These are the punishments according to the Qisas and Diyat Act. Coming to the classification of the hurt, hurt is classified number 1 into itlafe udu, which means whoever dismembers, amputates, severes any limb or organ of the body of another person is said to cause itlafe udu. Its medical interpretation: anatomical or structural loss of any organ or part of the body. Simply saying, loss of any organ of the body. Whoever dismembers, amputates, severes any limb or organ of the body of the another person is said to cause itlafe udu. So number 1, itlafe udu, loss of organ of a person. Next is itlafe salahiyate udu. As I said, the Arabic words itlafe salahiyate udu, whoever destroys or permanently impairs the functioning power or capacity of an organ of the body of another person or causes permanent disfigurement is said to cause itlaf-e salahiyat-e-udu. Simply meaning, if loss of function of any organ of the body is known as itlaf-e salahiyat-e-udu, means the salahiyat, the function is lost. In itlaf-e-udu, the organ was lost itself. Example, we can say the loss of eye means itlaf-e-udu. Loss of vision means itlaf-e salahiyat-e-udu. Loss of ear, itlaf-e-udu. Loss of hearing power, itlaf-e salahiyat-e-udu. Similarly, when organ is lost, it is itlaf-e-udu. When its function or physiology is lost, it is itlaf-e salahiyat-e-udu. So organ lost, anatomical loss. Itlaf-e salahiyat-e-udu, physiological loss. Medical interpretation, again, part remains intact for the itlaf-e salahiyat-e-udu. Part remains intact anatomically but becomes functionless physiologically. Example, injury to nerve supply of a part or injury leaving a permanent bad scar is the itlaf-e salahiyat-e-udu. Example, extensive scarring of the face in vitriolage. Vitriolage is a term which is used for throwing of a strong acid or alkali on opponent, and it causes the acid burn. This, if it is on the face and it causes the permanent loss or disfigurement, then it is the itlaf-e salahiyat-e-udu. So itlaf-e-udu, loss of an organ; itlaf-e salahiyat-e-udu, loss of function of an organ. Then injury number 3 is shaja. Shaja means whoever causes on the head or face of any person any hurt which does not amount to itlaf-e-udu or itlaf-e salahiyat-e-udu is said to cause shaja. Means any injury, plainly any wound on head and face other than causing the structural or functional loss is known as the shaja. So any injury on head and face which is not amounting to itlaf-e-udu or itlaf-e salahiyat-e-udu is known as the shaja. This shaja is again divided into 6 types. Number 1 is shaja-e khafifa, number 2 is shaja-e mudiha, number 3 is shaja-e hashmiya, number 4 is shaja-e munakkila, number 5 is shaja-e amma, and number 6 is shaja-e damigha. Now we will be doing it one by one. Number 1, shaja-e khafifa, the first type of injury of the shaja on head and face, which means wound which bleeds without exposing bone of the victim. Injuries classification according to qisas and diyat go from first layer of the skin to the deeper layers of the body. So any injury on head and face which bleeds, but through the injury the underlying bone is not exposed. Any injury on face, on head where there is a bleeding, but when we try to look through the injury, then underlying bone is not exposed, is not visible, then the injury will be termed as shaja-e khafifa. Number 2 injury is shaja-e mudiha, again step by step, that if through the injury exposing any bone of the victim without causing fracture. If we look through the injury which bleeds and we look through the injury, then we are able to visualize the underlying bone, but that bone is not fractured, then this injury will be known as shaja-e mudiha. And number 3 is shaja-e hashmiya. If we look through that injury and the bone is fractured. Either through the injury it is fractured, we can see it as a fractured, or on X-ray we find that the bone is fractured, then this injury is known as Shajai Hashmiya, provided the fracture is not dislocated, or the fractured bones are not in disalignment with each other. I may further explain it. In fracture, always there are two ends. If both the ends are in line with each other, they are in alignment with each other, then that fracture is said to be without dislocation. Shajai Hashmiya, fracturing the bone of the victim but without dislocation. Next injury, Shajai Munakila, by causing the fracture of the bone of the victim and thereby the bone is dislocated. Shajai Hashmiya was fracture without dislocation, but Shajai Munakila is the fracture with dislocation, means in this the fractured ends are not in alignment with each other. Then comes the Shajai Amma, means causing the fracture of the skull of the victim so that the wound touches the membrane. Membrane means meninges, dura mater, pia mater, arachnoid mater. So causing the fracture of the skull so that the wound touches the membrane, means injury or the force has reached up to the meninges, but meninges are not torn, not ruptured. In next, the Shajai Damega, causing the fracture of the skull of the victim and the wound ruptured the membrane of the brain, that is meninges, means there is a fracture of the skull bone and there is the rupture or tearing of the meninges, then such injury will be known as Shajai Damega. So a quick review: Khafifa, there is a bleeding without exposing the bone. Shajai Mudiha, there is a bleeding but the underlying bone is exposed through the injury but without fracture. Shajai Hashmiya, there is a fracture of the bone but without dislocation. Shajai Munakila, there is a fracture of the bone but with the dislocation. Shajai Amma, there is a fracture of the skull and the force touches the membranes, that is meninges, but meninges are not ruptured or torn. In Shajai Damega, there is a fracture of the skull and the meninges are also ruptured. So 6 types of the injuries under the heading of the Shaja. Then comes the Jara. Jara, whoever causes on any part of the body of the person other than the head or face a hurt which leaves the mark of the wound, whether temporary or permanent, is said to cause Jara. Means any injury on any part of the body other than head and face. Injury caused on any part of the body other than head and face is known as the Jara, and this Jara is again of 2 types. Number 1, Jara Jaifa, and number 2, Jara Ghair Jaifa. Jara Jaifa, whoever causes Jara in which the injury extends to the body cavities of the trunk is said to cause Jara Jaifa. Means injury to thoraco-abdominal cavity. When injury extends to the thoracic cavity, injury extends to the abdominal cavity, then it is known as Jara Jaifa. Jara Ghair Jaifa, whoever causes Jara which does not amount to the Jaifa, means hurt to thoraco-abdominal wall and the limbs. So hurt which comes under Jara, that any injury on any part of the body other than head and face. 2 types: Jaifa, when injury extends to the body cavity of thorax and an abdomen, and when an injury does not extend to the body cavity of the thorax and abdomen and it is on the either thoraco-abdominal wall or on the limbs, upper limbs as well as lower limbs, such injuries will be called as jara ghair jaifa. This jara ghair jaifa again has 6 types like shaja. Shaja had the 6 types. So the jara ghair jaifa means injuries not extending to the body cavities of thorax and the abdomen, and injuries are over the surface of the thoraco-abdominal wall or on the limbs, upper limbs and lower limbs. This jara ghair jaifa is divided again into 6 types. Jara ghair jaifa damiya, number 1. Number 2, jara ghair jaifa badiya. Number 3, jara ghair jaifa mutalahima. Number 4, jara ghair jaifa mudiha. Number 5, Jara Ghair Jaifa Hashmiya. And number 6, Jara Ghair Jaifa Munakila. 6 types, but just for your ease and telling you that out of these 6 injuries as Jara Ghair Jaifa, last 3 are same. Like there were the Mudiha, Hashmiya and Munakila and Shaja. So the same Mudiha, Hashmiya and Munakila are with almost same definitions here in the Jara Ghair Jaifa also. So starting with the number 1, Jara Ghair Jaifa Damiya. Again it is a minor injury in which skin is ruptured and bleeding occurs. So there is a minor injury, skin ruptured, bleeding occurs. That is the Jara Ghair Jaifa Damiya. Then is the Jara Ghair Jaifa Badiya. There is a cutting or incising the flesh muscles without exposing bone. Means any incised wounds, any injury caused by a sharp weapon where the muscles are cut but the underlying bone is not exposed. Jara Ghair Jaifa Badiya, where injury is caused by sharp and cutting weapon, but the underlying bone is not exposed. Jara Ghair Jaifa Mutalahima, where there is a lacerated wound, but again the bone is not exposed. So Jara Ghair Jaifa Damiya, minor injury. Jara Ghair Jaifa Badiya, incised wound without exposing the bone. Jara Ghair Jaifa Mutalahima, lacerated wound. Then comes the Jara Ghair Jaifa Mudiha, whatever the cause is, sharp injury or blunt injury or lacerated wound, but the underlying bone is exposed. So injury where underlying bone is visible through the injury is known as Jara Ghair Jaifa Mudiha. Then Jara Ghair Jaifa Hashmiya, causing the fracture of the bone but without dislocation. Hashmiya, similar like the Shaja. It was also fracture but without dislocation. Mudiha, underlying bone exposed. And the last one, number 6, is Jara Ghair Jaifa Munakila, fracturing and dislocation of the bone. So in Jara Ghair Jaifa, it will be Damiya, minor injury, Mudiha, Abadiha, incised wound, Mutalahima, lacerated wound, Mudiha, underlying bone exposed, Hashmiya, fracture without dislocation, and Munakila, fracture with the dislocation. So 6 types of the hurts again in Jara Ghair Jaifa injuries. Then next type of the hurt is other hurts, which is known as the other hurts, and it is divided into 2: other hurts subsection 1 and other hurts subsection 2. Coming to the other hurt subsection 1, hurt which endangers life or which causes the sufferer to remain in the severe bodily pain for 20 days or more, or renders unable to follow his ordinary pursuits of the life for 20 days or more. So any injury which is life threatening, number 1. Number two, which causes the sufferer to remain in the severe bodily pain for 20 days or more, or renders him unable to follow his ordinary pursuits of the life for 20 days or more, or simply we can say who remains hospitalized for the period of 20 days or more, it comes under other hurts. Those injuries which were not mentioned in Shaja, Itlaf-e Udu, Itlaf-e Salayat-e Udu, in Shaja and in Jara. And these injuries are life-threatening and causes the person to remain 20 days hospitalized or out of the normal pursuits of the life, then such injuries will be classified as other hurts subsection 1. Common example of the other hurt subsection 1, any injury which endangers the life but which is not mentioned in Itlaf-e Udu, Itlaf-e Salayat-e Udu, Shaja or Jara, and keeps the person hospitalized or out of the normal pursuits of the life for 20 days or more, will be termed as or labeled as other hurt subsection 1. Then is the other hurt subsection 2. Whoever causes hurt not covered by subsection 1. This is even given that some things are missing, which are missing injuries. These will be covered under subsection 2. And the common example for this is the bruise or contusion, which is not mentioned in any injury we have discussed up till now. So that bruise will be labeled as other hurts subsection 2. I repeat, bruise on any part of the body, contusion on any part of the body will be labeled as other hurts subsection 2. Then another term according to Qisas and Diyat Act is iskate hamal, which means whoever causes a woman with a child whose organs have not been formed to miscarry, if such miscarriage is not caused in good faith for the purpose of saving the life of the woman or providing necessary treatment to her, is said to cause iskate hamal. Another term according to the Qisas and Diyat for miscarriage, and simply if that miscarriage was caused in first trimester, because first trimester is considered to be as the period of the organogenesis. So iskate hamal or the miscarriage, loss of a child in first trimester will be termed as iskate hamal. Only exception is that if it is not caused to save the life of the mother or life of a woman, then such loss of the child or miscarriage of the child will come under section 338 iskate hamal. Then is the iskate jani. Whoever causes a woman with a child, some of whose limbs or organs have been formed, to miscarry, if such miscarriage is not caused in good faith for the purpose of saving the life of the woman, is said to cause iskate jani. Simply, after the period of the organogenesis, that after the first trimester of the pregnancy, if miscarriage is undertaken and it was not because in a good faith to save the life of the woman, then such act will be known as iskate jani under section 338b. Although, and these topics of iskate hamal and iskate jani we'll be doing while we'll be doing the forensic gynecology or forensic sexology. Then is the term qatl and its types. Qatl, again common in the Urdu, which means killing, causing a death of the person. This killing, according to Qisas and the Diyat Act, can be of 4 types. Number 1, Qatle Amd. Number 2, Qatle Shibih Amd. number 3 qatl khata, and number 4 qatl bisabab. So qatl, killing of a person, causing a death of the person in Qisas and Diyat is known as the Qatl, and it has 4 sub-varieties: Qatl Amad, Qatl Shibih Amd, Qatl Khata, and Qatl Bisabab. We shall be discussing one by one. Number 1 is Qatl Amd, means intention of causing death. So, Qatl or killing of a person with intention of causing his death, intention of causing bodily injury, with an act which in ordinary course of the life is likely to cause death. So number 1, if there is a killing by intention of causing the death, it is qatl amad. Number 2, if there was an intention of causing bodily injury by an act which in ordinary course of the life is likely caused to the death, then that is also known as the qatl amd. And the punishment under section 302 is death as qisas, and the life imprisonment, or the life imprisonment as the tazir. And the tazir, life imprisonment in Pakistan, is 25 years jail imprisonment. So qatl amd, causing a death of the person with intention. Number 2 is qatl shibih amd, means causing the killing or a death of the person with intention of causing harm by weapon or an act which in ordinary course of the life is not likely to cause death. So causing the death of the person by causing harm by a weapon or an act which in ordinary course is not likely to cause the death, such death will be known as qatl shibih amd. And the punishment for qatl shibih amd is the person is liable to diyat, or the person is liable to 25 years jail imprisonment as tazir, qatl shibih amd. Number 3 is qatl khata, which means there was no intention of causing the death or harm to the person, but qatl occurred, or the killing occurred, due to mistake of the fact or mistake of the act. Punishment under the qatl khata is diyat, where rash and the negligent act is the cause of death. And person may also be imprisonment for 5 years in addition to the diyat, rash and negligent act. And the next is the punishment for qatl khata by rash or negligent driving. In this, punishment can be diyat. In addition, 10 years imprisonment may also be possible, depends upon the court's decision. In first example, that is the rash and negligent act, doctors are also sometimes alleged for the medical negligence, so their action may also be taken as a rash and negligent act, in which there is the possibility that the court may punish the doctor with the diyat and the 5 years jail imprisonment also. So mentioning of this is with the fact that we doctors of today and the doctors of the future, we should be well aware that what are the different possibilities, consequences if we if we do any rash or negligent act. Number 4th is the qatl bisabab, where there is no intention to cause death or harm, but some unlawful act which becomes cause of the death. Person has no intention of causing the death or even harm to the other person, but he performs some unlawful act, and that unlawful act becomes the cause of the death, then such will be known as qatl bisabab. Example is that a person digs any ditch in front of his house which was not allowed, or the act of digging a ditch in front of the home is unlawful, and because of that unlawful act, if anybody falls in that ditch, the person will be tried under this qatl bisabab, and the punishment, the person is liable to the amount of the full diyat. So katle amd, katle shbihe amd, katle khata, katle bisabab. So this was all about the today's session.